Okay, Abdullah, so I would like you to present the case.
Okay. So Fahad is 23 years old. He have a grade for male. He have a grade for pancreatic cancer.
Okay.
Metastasis. He is terminal ill. He has also hepatomegaly, kidney dysfunction, and that's it. He has been in the hospital for last 2 months.
Okay. Thank you, Abdullah. Thamer, I would like for you to present the vital signs.
Okay, so the patient is hypotensive. The blood pressure is 80/40. The heart rate is 50, and the respiratory rate is 8.
Doctor, I see DNR in the board, and I didn't get it. Can you please tell me what is the DNR?
So what DNR stands for is Do Not Resuscitate. It is a code or a written rule that allows patients to allow natural death without any cardiopulmonary resuscitation or any type of life support.
So, doctor, what is the criteria for DNR?
So for DNR, the patient has to be terminally ill. For example, with cancer, as in the case, the patient has grade 4 pancreatic cancer, as you said, or any other type of cancer that prevents him from basically leaving the hospital or doing normal functions. So the criteria for as we've said, the patient has to be critically ill, and with the help of 3 consultants, 3 experts, they should revise or go over his case and decide if the patient is allowed to have a DNR or not. And of course, it is allowed in Islam.
Hi, my name is Michelangelo Mortellero, and I'm an elder law attorney with Mortellero and Sinodinos in Tampa. Today we're going to talk about the DNR and how that DNR differs from a living will. Many people believe that they want both of those documents, and they are generally mutually exclusive in that you will want to make a decision and pick one over the other. So first let's talk about the DNR, what does it do, and then we'll talk about how that differs from the living will. A DNR is a directive that is signed by you and your physician that says you do not want to be resuscitated in the event that you code or your heart stops beating. And that can be from anything, that can happen anytime from whether it be a heart attack or whether it be on the operating room table, anything like that where they might have the possibility and the potential of CPR, paddles, anything that would get your heart going again and effectively bring you back to life. This directive will tell them that that is not what you want. So if your heart stops beating for any reason, they will not bring you back. So that is the DNR, and then we're going to talk about how does that differ from the living will. Well, with the living will, the directive only affects the decision to keep you on long-term life support or take you off of long-term life support. However, the doctors and the staff will always do everything to bring you back, get your heart started, and put you on a machine temporarily to allow you to get as good as you're going to get and to evaluate you and determine whether you have a medical probability of ever getting better, getting stronger, and coming off of those machines, whether it be kind of feeding tube or ventilator. So with a DNR in place, we never get to that point of bringing you back, stabilizing you, and evaluating you. We typically stop at the point of coding or the heart stopping. So why would you choose one over the other? There are several factors to consider. One is your current quality of life or your quality of life at the time that the event happens. So I'll use my grandfather as an example. Suffered for several years from COPD. You know, every breath was a struggle for quite a while. And his last visit into the hospital, he said, you know, if something happens to me while I'm here, I honestly don't want to come back. And because if I do, I'm going to come back to a daily struggle and pain and suffering. So I'm making the choice that if something happens to me, let me go, don't kickstart the heart again, and that's what he wanted. And I think that was the right choice for him. The beauty of estate planning in general and planning for long-term care is that you're in charge. You get to make the decisions. And some people say, bring me back and do everything you can because maybe they'll come up with a cure for whatever I have. Perfectly fine. If that's your choice and that's what you want, then that's exactly what we're going to give you, versus the person that says, I've had a good life, I'm ready to go, don't bring me back. Another thing to consider is age. One of the things I've learned from working in conjunction with Gulfside Regional Hospice is that as you get older, things like osteoporosis do affect your whole body, and things like chest compressions and CPR for an older person in their late 80s or 90s might actually do more damage to them. And while technically they might be able to get the heart started again and bring you back, the damage suffered by cracked ribs, punctured lungs, things like that, may ultimately prove to be terminal later on down the road anyway. So it is one thing that you want to consider, not only what your wishes are, but where you're at in life, and what might be the consequences of heroic measures to bring you back. That is a good discussion to have with not only your family, but with your elder law attorney, and be educated on what happens, what are the options, what are the risks, and then ultimately make the decision that's right for you and your family.